One of the things that we noticed when we did our interviews with other doctors throughout the country, I mean, that actually really kind of inspired me, was how few, especially we spoke to a bunch of them who had practices similar to ours, where they had a lot of people with chronic Lyme or chronic fatigue, and they didn't have hardly any. In fact, most of them said they had none or no patients of their own who developed long COVID, that all the long COVID patients they were seeing were new to their practice. And that was exciting because we were very concerned in the beginning of COVID, as were our patients. I think that, my God, that COVID was going to be the worst, was a sure bet to really worsen their previous chronic fatigue symptoms.
Yeah, most of our patients did just great when they had COVID. They didn't develop long haul. I think that's because we were pressing on those infections already in treatment. We're already modulating their immune system. So when COVID came along, dormant infections didn't really have a chance to rise up. They were being treated. The immune system didn't really have a chance to go off the rails because it was already being modulated. So it was really
it was validating.
Yeah, it's wonderful.
It really was validating that making sure that people were on, the basic supplements, making all our patients, we've always made sure that their vitamin Ds were adequate, that their glutathione was adequate, that selenium and vitamin C. Those are just the basics. The basics were all covered,
but beyond the basics, though.
Well, hopefully a little bit
with the peptides and killing off infections and all of that.
The bottom line is that we didn't see long COVID. Now, I mean, again, I'm sure there are patients out there who were taking those things who unfortunately have developed long COVID, but by and large, that was not the experience.